Well, welcome everyone. I'm really excited to talk to you about this topic today about closed loop integration and how it targets burnout and improves clinical workflows, but also other workflows as well. This is definitely a topic I'm very passionate about, and I hope you get a lot out of it. So, a quick agenda. I'll do a little bit of background and introduction to myself, as well as my experiences within the healthcare space over the past decade and a half. And then really we're going to talk about what's going on with burnout. We're going to try and get to the root of the problem and understand it, and then understand how we can address it with closed loop integration. Finally, we'll spend some time talking about the Health Catalyst way for leveraging closed loop integration and doing this as a service for our customers and other organizations to help provide analytics at the point of decision making. We'll end our time today with some questions. So, like Sarah said, I've got a pretty long history within the healthcare IT space. I started my time at Epic, kind of managing the surgical products at Epic, including Optime and anesthesia. I moved in the analytics space for a company called Click, and then moved to the University of Wisconsin, where I completed my Master's of Public Health, focusing on biostatistics and epidemiology. I also moonlit as a director of BI at UCSF and Johns Hopkins, helping them to implement the Epic business intelligence suites at both of those organizations. In 2016, I joined Health Catalyst, where I work on pretty much everything to do with integration and interoperability. And fundamentally, my role at Health Catalyst is taking the analytical output from a lot of our products and embedding that into workflow tools, oftentimes being the EHR. So I thought I'd start our time today with a short story on short cases. So, like I said, I started my career in health IT at Epic, working on their surgical products. And at the time, I actually helped pioneer Epic's anesthesia information management system. So for several workflows, and oftentimes if you're familiar with workflow EHR tools like Epic, we don't really develop anything new. We actually just add content to existing functionality. So we were working with our first pediatric anesthesia customer, and we're in design sessions with an anesthesiologist at our first pediatric institution with a very combative provider we'll call Dr. Dave. And anesthesiologists are known to be pretty demanding, and that's okay, I can work with that. But Dr. Dave was straight up obstinate. Towards the end of the session, he asked the pointed question, how long do you think all this stuff in Epic is going to take? And we responded, it wouldn't be too long. It'd be about 5 to 10 minutes. At this point, he actually exploded in an expletive-laden rant about how this system was going to kill his patients. After he left, we actually found out that the vast majority of his cases were actually myringotomies. If you're not familiar with a myringotomy, it's for usually for young children who have a hard time having fluid drain from their ears. And so they add these little ear tubes to help them drain so that they don't get ear infections. And the average case length for a myringotomy was only 7 to 12 minutes. So we were asking to potentially double the workflow that he had for most of his patients. And this was kind of a humbling experience, but it still was pretty a frustrating experience and frustrating interaction with Dr. Dave. So we progressed through the implementation process, and we're leading up to go live. And part of the process with go lives at Epic is actually we bring out Epic staff to help support the go live. And we were actually recommending that our go live support staff not interact with Dr. Dave. We told them that if he had any problems or had any frustrations, to direct him to the project team staff or to the Epic staff that were responsible for the project, myself included, just because we didn't want our support staff to have to encounter a kind of a frustrated provider the day of go live. And go live can be pretty frustrating. It's a very tense moment, turning on the system and having people use it for the first time. So I was actually a little apprehensive of what my first experience and kind of first interaction with Dr. Dave was going to be that first day of go live. But my first experience with Dr. Dave was actually a really monumental and kind of completely surprising experience. My first interaction with Dr. Dave, the first day of go live, was actually witnessing him in a PACU bed with a young child cradled in his arms. And he was gently rocking her back and forth as she was coming out of anesthesia. She was whimpering softly, and he was just whispering really, really gentle things to her and comforting her while he waited for her parents to come into the PACU. And this was just such a drastic difference between the person that we saw during those design sessions and ultimately the type of provider he was. And this actually This experience was really formative for me in my healthcare career because it was an important reminder that care actually happens here between a doctor and a patient, not between the doctor and a computer. And that's essentially a really important thing that I've taken to heart with the rest of my healthcare career. And I want to set that as kind of the foundation for what we're going to talk about today. So let's jump into this topic of burnout. If you do a Google search, there's lots of literature on this. It seems like almost daily, maybe even hourly, we have more and more articles that are coming around that are summarizing this problem and trying to address this problem of provider burnout and physician burnout. And if we look at the kind of points about this, the summary is that 54% of doctors say they are burned out. 88% of doctors are moderately to severely stressed out. And I think the really sad one is 59% of doctors wouldn't recommend a career in medicine to their children. I think this piece of data is really telling because we're not just losing our existing providers, they're actually discouraging our future providers. But if we take a closer look at the literature, 3 important factors about the EHR and provider burnout begin to bubble up to the surface. First, doctors spend a lot of time in the EHR. A really important piece of literature that came out of the University of Wisconsin showed that a primary care physician spends nearly 2 hours on EHR tasks for every hour of direct patient care they complete. They're spending 6 hours in a 10-hour shift doing work within the EHR. But maybe a little bit surprising, it's not actually the EHR's fault. Another piece of literature that's coming up came from Dr. Atul Gawande, who's a really important voice in US healthcare. Gawande published this article in both the Annals of Medicine and the New Yorker about why doctors hate their computers. And he focused around the fact that EHRs were not originally built as clinical tools. They were systems built to organize data around an encounter for billing reasons. This is in direct conflict with what providers need, a system that organizes data around a patient for care reasons. And this leads us to our third factor that's bubbling up, the concept that the EHR isn't causing physician burnout so much as it's causing moral injury. So what is moral injury? In Dr. Talbot and Dean's article, they borrow the term moral injury from the military, where soldiers were tasked with objectives that may have conflicted with their moral or ethical standards. And the same goes for physicians and other care providers who are tasked with documenting and capturing things unrelated to a patient's care just to optimize billing. All the while, they need to do things like not make recommendations for treatment that a patient's insurance won't cover or that a patient can't afford. With that, we have our first poll question of the day. So, how much do you think the EHR is contributing to provider burnout? Do you think the EHR is the primary cause of provider burnout? Do you think the EHR is a contributing cause of provider burnout? Or do you think the EHR isn't contributing to provider burnout at all?
All right, we'll give you just a few moments to get your votes in here. They're coming in pretty fast and furious right now. If you joined us late, as a reminder, we are recording today's session and you will have access to that recording. We will also make the slides available after the fact. Okay, we'll give you just one more moment here. All right, it looks like we're slowing down. I'm going to go ahead and close that poll and share the results. So it looks like 8% think the EHR is the primary cause of provider burnout. 90%, our vast majority, think it's a contributing cause of provider burnout. And only 2% said the EHR is not contributing.
That's awesome. Appreciate you participating in that poll. And that's kind of been our experience as well. We recognize that the EHR at the end of the day is a tool and that there are contributing factors, but we have the opportunity to mediate those factors. It's also important to note that physicians actually only comprise 5% of our US healthcare workforce. So there are several millions of workers that are healthcare workers that are also experiencing what we're thinking about as burnout. They're just not physicians, right? So with that in mind, today I want to talk about the 1, 2, 3s of closed loop integration services and what that means for addressing this really critical problem within our industry today. So the 1, 2, 3s of closed loop integration services are going to comprise of 1 what, 2 whys, and 3 hows. So let's start with the what. What is closed loop analytics? Closed-loop analytics is the delivery of analytical insights in a manner that can be immediately acted on. And this might seem like an abstract topic, but really, we're actually used to closed-loop analytics. We're just not used to it in healthcare. So if you add a product to your Amazon basket, oftentimes Amazon will actually recommend to you other objects that you can buy in unison. And this is based on what other previous kind of customers have purchased together. Behind the scenes, we actually have lots of data that's being crunched together, analyzed together, and providing you, as the end user, an option to do something extra. This is closed loop analytics. We're also used to it in things like Netflix, where recommendations are based on the preferences that you have, the movies that you've watched, and other utilization and user data that from other experiences from other people, right? Same idea goes for things like Rotten Tomatoes, where we on demand kind of show you what other people have thought about a movie as well as what kind of critics have thought about a movie. Take all of that data and put it into things and sync it up with theater data and localization data so that you can actually see if a movie is something that you'd like and then actually immediately take action on it and schedule a time to go see it. We're also used to it in things like GPS, which has evolved to allow not just the directions that are appropriate for you to get to a destination, but what's the fastest way to get to your destination. And this is taking into account things like historical traffic, current traffic, and even geographic data. So what's going on within healthcare analytics? Well, in healthcare analytics, we have very similar workflows to these other industries. We just do things slightly differently. So our end users work with a workflow tool like the electronic health record. We take that data and put that in to a data warehouse with other data, and this we call maybe an analytics engine, and the output is oftentimes things like reports or dashboards or web apps. But this is where healthcare stops, and this is ultimately the problem, because in healthcare analytics, the integration is actually done by the end user, right? An end user translates an insight they gain from a dashboard or a report or a web app, and they have to physically determine what that means that they need to do within their workflow tool, ultimately being the EHR. But what if closed loop analytics worked in healthcare the way that we experience Amazon or Netflix, right? We'd be able to bundle treatments or recommendations for a patient in one step instead of requiring multiple steps to complete those tasks. If closed loop analytics worked like Rotten Tomatoes, we'd be able to see peer or patient data and see multiple treatment options and be able to surface those up very seamlessly at the point when a provider actually can make a decision on it. If we treated Waze and Google Maps or Apple Maps the same way that we experience the EHR, we would be able to give guidance, not simply directives, not stop signs everywhere within the system. We could recommend and provide guidance of what the best options were. But why is this important to have analytics in healthcare that can be immediately acted on? It's because we know it works. We love this statistic because it hits home why it is so valuable to present the output of analytics at the point of care. Clinicians are actually 15 times more likely to act on a best practice when it's presented to them at the opportunity that they can actually take action for it. So this is our two whys for closed loop analytics. It improves the utilization and the effectiveness of data, which results in better workflows. While important, our efforts shouldn't be about just reducing the time in the EHR. We need to make the time in the EHR effective, and that means making better workflows. I want to talk about a recent case study that we published involving Unitypoint Health in the Midwest. So Unitypoint Health had a problem, which a lot of our healthcare organizations have. They had several thousands of patients suffering from a chronic condition called COPD. And the problem that they have is that they had limited resources to take care of this patient population. So how can they adequately manage this population of chronic patients with limited resources? So we at Health Catalyst did what we do best. We organized the complicated data around understanding this cohort of patients and then applied the best of the evidence base to develop a tool to help monitor and manage these patients. And this is where we encountered our second problem. Our end users were primarily nurses and care managers. And while they thought the tool was great, their primary administrative tasks were being completed within the EHR. And the function that they were trying to do was validate patients that were escalating in clinical condition so they could actually enroll them in more aggressive care management. So without some sort of integration with the EHR, this tool would go unused. So what we did was we configured the Unitypoint COPD Tableau application to embed directly within their EHR, which happened to be Epic. We then configured the application to launch directly into the Epic Activity Chart Review. The result was we reduced the barrier to accessing the application, as well as simplifying the intervention that they wanted to actually do. And this improved the utilization of that tool. But it's also important to note that it improved the effectiveness of it. We had an 83% relative reduction in clicks around this workflow. Can you imagine doing anything 6 times faster? And it was important that it wasn't just about improving the workflow for these nurses and care managers. We also improved the documentation and process aims for these patients as well. So not only did we improve the workflow, we also improved care. And that leads us to our second poll question. In the next 3 to 5 years, how much will advanced analytics through things like machine learning and AI and improve healthcare workflows? Do you think it'll be inconsequential? Do you think the EHR is too difficult to configure and many EHRs have incompatible infrastructures? Do you think that it'll be insignificant, that it'll be functional for niche workflows, and advanced analytics might provide targeted interventions or improvements? Or do you think it'll be significant, that all workflows will receive a significant boost from advanced analytics? Or finally, do you think it'll be disruptive, that technological innovations and changes in care delivery models will actually introduce new workflows that augment or replace much of what the EHR does today?
All right, we'll give you a few more moments to submit your responses there. Again, people are pretty quick today.
Awesome.
People are on the ball. And as a reminder, we are recording today's session. You will have access to the slides, and Jeff will be holding a Q&A session at the end of today's presentation. So please do submit your questions as they become top of mind. All right, we're going to go ahead and close that poll and share the results. So it looks like only 2% thought inconsequential, 12% reported insignificantly, 68%, our majority here, said significantly, and 18% reported disruptively. So definitely the majority leaning towards that significant disruptive area.
That's awesome. And I think there's a lot to be optimistic about and hopeful for. And that's going to drive us into our next portion of how do we actually make that happen. So with that, let's move into our 3 hows for closed loop integration. So we at Health Catalyst see that closed loop analytics integration kind of takes 3 formats. The first is pretty simplistic. It's the idea of a data integration. And this is just connecting the analytics environment to the EHR's transactional database, which allows you to use more comprehensive and advanced analytical capabilities, but still send that back to the EHR for it to use its kind of inherent functionality. The second is a solution integration. And this is just embedding applications or BI tools that you've already developed directly into the EHR. And the primary focus of that is to decrease barrier to access of analytical data and continue to build data literacy. Finally, we have the highest sophistication, which is workflow-based analytics integration. And this is creating or augmenting existing workflows with analytical data and doing things like triggering activities within the EHR or completing actions that update the EHR altogether. Let's dive into that a little bit further. So closed loop analytics data integration, we have our similar function as before. You have your end users working on a workflow tool and that data is sent to the analytics engine. And the output might be something like a risk score that we can then send back to the transactional system of the EHR. And use cases for this can be pretty varied and pretty powerful. Simply doing things like decision support or surfacing up that value within a patient header or using that score to do patient list prioritization are all examples of just creating a risk score and doing something analytical with the data and still leveraging the functionality within EHR to improve the workflow. And there are a lot of methodologies that we can do to get data back into the EHR. We can go as old school and kind of archaic as flat file imports, where we just take something like a CSV dump and that's batch loaded every day, to using EHR tools that are built to allow external data sources to send data back into them they're at the transactional level. And then we can get even more sophisticated, leveraging interface engines that use standardized interface languages like HL7 or movement towards standards like FHIR, all the way to APIs and web calls with EHRs, which allow a lot more sophisticated integrations with those systems. If we think about this as well, we should think about when should you do a data integration project. I'm a big proponent of not just sending the data back. Data should always have a purpose. And with that in mind, we should leverage analytical capabilities that aren't inherent in the EHR, and then use those to boost EHR functionality. So things like using machine learning or artificial intelligence to more accurately define a patient at risk will improve the decision support that would ultimately send an alert. And this can actually decrease alert fatigue. We can also leverage this type of capability to do workflow prioritization and even leverage native EHR functionality with smarter capabilities. Next up, we have solution integration. And this oftentimes takes the form of just taking something like a BI dashboard and embedding that directly back into the EHR. And this can improve things like data literacy, but also provide the outlet for people to do hospital-acquired infection surveillance, as well as census planning and discharge planning. And there's quite a lot of content that you can actually embed into the EHR. Almost any web-deployed content is possible. And you can embed into pretty much any EHR that allows external content. But it's important to recognize that the EHR is not always the workflow tool. So there are billing systems, there are pharmacy systems, there's even SharePoint, or we've even helped customers integrate solutions with Jive. And it's really important to recognize that you can actually integrate a lot more into your workflow systems than you probably realize, and it's not that hard. Finally, next up is the kind of a dive into the solution integration and when you should do these. So building analytical products that need increased visibility into the EHR are really important. Again, surveillance-based tools that can help end users keep a pulse on their domains of responsibility are also valuable. Census, infection control, even patient throughput for nurse managers are valuable opportunities. Things to remember when addressing analytic solution integration projects is to think through how users should interact with embedded solutions. You should try and be consistent so that the workflows are consistent. Finally, we get to analytics workflow integration. And this is the highest level of sophistication and really is encompassing either augmenting an existing workflow or inventing a new one altogether. And the use cases for this are directing a known intervention for things like care gaps or bundle compliance, or doing more aggressive care management and population health. So when should you do a workflow integration project? Analytics that provide a defined intervention are really good opportunities for this. Additionally, we can leverage these tools and workflow tools to actually prioritize a workflow and launch into a workflow that's in the EHR, as well as using these opportunities to sync external data about a patient. Things to remember is always think about the workflow. It can't be additive. The whole purpose of closed loop integration is to improve the workflow, and that means that it has to be faster, decrease clicks, optimize the information that your providers are reviewing at any given time, and prioritize work. Let's look at another case study. This one involves workers that weren't clinical in nature, and so also hopefully highlights to you that it's not just about our clinical staff, but everybody that works within the EHR. So at Multicare Health System, they have to prepare thousands of claims for the various business lines within their organization. How could they prioritize the work of their accounting and billing staff to minimize the denials of claims for avoidable things like missing documentation? So, like before, we did what we do best. We organized the complicated data around understanding revenue cycle and denials management, and applied the best of the evidence base to develop a tool to help monitor and manage and prioritize these accounts. And so we developed this tool and then gave it to these billers. And we encountered a very similar problem. The tool is great, but the end users, in this case billers and AR staff, needed to actually work the accounts within the EHR, which provided the hospital and professional billing software. So without some sort of integration with the EHR, this tool would again go unused. So what we did was we configured the Multi-Care Revenue Cycle Explorer app, which happened to be a ClickView application, directly within their EHR, which also happened to be Epic. And we configured the application to launch directly into the Epic activity hospital account maintenance. This, again, reduced the barriers to accessing the application, as well as simplifying that intervention. And this is another published case study that we have. We had almost 15 million reduction in denials and avoidable write-offs. But what is more impressive is the numbers that after a year, we had almost 250% increase in monthly distinct users for the application, as well as almost a 400% increase in monthly sessions. And the number of users accessing this application directly from within Epic was over half of them. So let's talk a little bit about the integration services that Health Catalyst can provide for you. You don't actually have to be a Health Catalyst customer. We can assist as a strategic service in helping you understand your analytical environment as well as the workflows that you have and deliver integration capabilities for the content that you've already created within your organization. If you're a new Health Catalyst customer, we can help deploy your analytics projects right out of the gate so that you increase the opportunity for adoption and effectiveness for all of your outcomes improvement projects. If you're an existing older Health Catalyst customer, we can help evaluate what you've already deployed and provide closed loop capabilities to increase the utilization and effectiveness of what you already have. Along those lines, we have a lot of collateral that comes with our services. In addition to an integration assessment that we do at the start to understand what your project needs are, we have a lot of project management based tools and content that we provide for you, including a project plan, as well as elbow to elbow building and testing assistance, and even go live support calls. Here's an example of a project plan that we have, as well as a full scoping and assessment questionnaire that's provided in sync with it. What are the timelines and resources that are needed? We also, well, those will vary based on the project that you'll need. So we anticipate that a data integration project will take about 4 to 6 weeks, depending on the integration. And this will require about a tenth to a quarter of an EHR builder's time and about a quarter of a data architect's time. A solution integration project will take about 4 to 6 weeks, depending on the solution, and again, take about a tenth to a quarter of an EHR builder's time. For a workflow integrations project, we anticipate this taking a little bit longer, 6 to 10 weeks, depending on the workflow, and also, again, take about a tenth to a quarter of an EHR builder's time. When we talk about these timelines, this is how it breaks down. This is an example of our solution integration implementation timeline. The assessment takes about a week where we come on site and help you understand what the needs of your workflow and your analytical product are. Is it just to improve the utilization of the product, or is it to develop integration points directly in the product and then do things like embedding the tool? Next comes the build, which actually isn't usually that hard. It's mostly in this build time frame is standing up a representation or a POC within an environment and within a test environment, and then leveraging that time to also have security and governance discussions with key stakeholders within your organization. Then we move into the adoption and the primary go live, and then follow up with optimization efforts at periodic intervals. And along with this, we also have the capability to make this reproducible for you as an organization. So we have integration subject area marks that we'd be able to actually deploy within your organization that actually very quickly and easily simplifies how you can create these capabilities within your analytical products. So in summary, we have the 1, 2, 3s of closed loop integration services. We have one what, which was the delivery of analytical insights in a manner that can be immediately acted on, the 2 whys of improving utilization and effectiveness, and then the 3 hows, the data solution and workflow integrations with the EHR that can drastically improve end user workflows. And then with that, I think we have one last poll.
Yep, I will go ahead and launch that here. Before we dive into the Q&A, we'd just like to say, while today's webinar was focused on our new closed loop analytics service, some of you may want to learn even more about the service or our other products or professional services. If you would like to learn more, please answer this poll question. And we'll go ahead and leave that open as we dive into the Q&A. We are diving in, so now's the time to submit your questions if you haven't already. So we're going to start with this question from Rick, who asks, how are you handling reportable patient safety events from the EHR?
So at least at Health Catalyst, we actually have a separate patient safety product. And so that patient safety product is part of a patient safety organization and is actually separated from the EHR. So we actually avoid closed loop analytics and kind of integration between our PSO and the rest of our analytics products.
Okay. Next question. I'm going to put this a little broader. Yao's asking about the scarcity of analytics and ML skills in South Africa specifically, and how do they combat that? So I'm going to say more broadly, what are your suggestions for people that are working in these areas where there is this skill gap? Mm-hmm. If you have any advice there.
Yeah, that's a great question. I think that is going to be less of a problem as we kind of move forward. I think it's a pretty big problem right now, just because it's a up and coming field. But machine learning and stuff, I think a lot of organizations have an opportunity to kind of productionalize or productize machine learning. And as those things become more prevalent, those will gain opportunities for places that don't have that knowledge base to leverage that capability without necessarily having to gain that knowledge.
Okay. Your next question comes from Paul, who asks, you mentioned something called the Epic Activity Chart Review. Can you say more about this and how or whether it is exposed for external integrators?
Yeah, that's a great question. So several EHRs have the ability to actually, once a tool is embedded into the EHR itself, you can actually configure that content that gets embedded to launch tools natively within the EHR. So in this case, we were able to use little URL strings that launch Epic activities, and so we actually launched the Epic Activity Chart Review using this URL string. So for more information, you can definitely reach out to me, or actually, if you are an Epic customer, you can talk to Epic as well. None of the stuff that we're talking about is hacking the EHR. We're actually just using standard Epic configuration or EHR configuration.
All right, your next question comes from Joe, who asks, do you always start the closed loop analytics projects in one area, like COPD? Where are the lowest hanging fruits? So like, where's the easiest way to get started?
Yeah. Hey, Joe. Good question. So historically, we've usually had a product that was produced that was really, really valuable, but didn't have very strong adoption. And so that's when usually we get engaged to try and embed that into the EHR to increase the visibility of it and then increase the adoption of it. So that's historically. But as we've been moving forward, a lot of our organizations are taking the approach to do this right out of the gates. And building this inherently into tools that we produce. At Health Catalyst, we have several domain areas and products that we create. We just have a lot of knowledge in, so subject areas like sepsis or chronic conditions like COPD and asthma and diabetes, and those types of tools. A lot of our customers are actually just doing the embedding within the EHR with integration actions right from the start, right from the beginning of the implementation. So.
Okay, another question. So you kind of mentioned these three different categories of people that you could be working with. So people that aren't Catalyst customers, people that are new customers, and people that are existing longer term legacy customers. What's the timeline for each of those groups to get up and running with closed loop analytics? Because I assume it kind of varies between.
Yeah, that's a great question. So it really depends on the organization, and then it depends on the project type. So those I think are the two primary variables. So if it's something as simple as trying to send a data value back to the EHR, that's actually pretty simplistic, and it doesn't really vary from the type of customer you are, whether you're not getting you're not a Health Catalyst customer at all, or you've been an existing customer for a very, very long time. So essentially, it's just discussing the methodologies for taking the data system that you want to send something back to, and then your target system, so primarily the EHR, and then kind of defining the method for that, and then lining up the work and the build to do it. For things that are more kind of sophisticated, like workflow integrations, those can be projects that take a lot longer simply because they require a lot more resources and they're nuanced, right? One of my personal commitments is that I want to make the workflow better. So it's not a matter of just saying, oh, this is cool and this is fun to do, and we built this really pretty thing, so we want people to see it. It's a matter of the workflow. Is it actually going to support an end user's workflow and make their lives better? You'd be surprised. Some of the ugliest dashboards I've made have had the most important impacts on end users because we focused on doing things around the workflow and what value it could provide, not just creating a pretty tool.
Okay. Well, let's see, we had another. Oh, just some praise coming in from Nicola. Impressed with the limited human resources required, as well as the ease of integration. So
yeah, I think that's actually something that people find is really surprising. The configuration within the EHR is actually oftentimes not that difficult. It's more kind of wrapping people's heads around the fact that this is data or content that is external to the EHR that is now being accessible from within the EHR. And then that brings up a lot of security concerns and worries around governance. And those are all addressable. Those are all understandable. It's just helping to educate people on what's possible. So.
Okay, and then you have a couple questions here from Craig,
Mm-hmm.
who's asking if have you done any work with Cerner or Meditech?
Definitely done work with Cerner. Done work with Allscripts as well. Meditech also has the capability, but I haven't personally done that type of integration with them. So.
But it's possible?
Yes.
Okay. Any last minute questions lingering out there? Now's your chance to submit those. I guess I could ask you one more about, so a lot of the tensions here seem to be coming from the clinicians working with the technical tools and those things. So do you have any advice for getting the clinician buy-in towards using closed loop, because that's such a big important thing to have happen before actually engaging with these types of projects?
Oh, Sarah, great question. So the very beginning is getting people more data literate. And that's actually, it sounds kind of logical and easy, right? It's actually pretty easy, like I said, to throw stuff into the EHR. But whether people are going to use it and whether they understand it is, I think, the important factor and is incredibly nuanced. I think once people start getting used to the fact that they can actually do something with the data, right, and then see it in a different light, not just see something in flow sheets or tons and tons of numbers in what amounts to a spreadsheet, right? When they can see insights in that way, that really starts getting people enthusiastic of the possibilities. And ultimately, it doesn't hurt if you can make their workflows 6 times faster.
Sure. I think anybody in any work would appreciate that, right?
Yeah.
Well, that looks like that's all the questions we have for right now. Any closing comments?
Yeah, I wanted to leave everyone with this quote from Dr. John McCreary, a friend of mine who I worked with while I was implementing anesthesia at Epic. Make it impossibly easy for me to do the right thing. I really believe that closed loop analytics is what enables this. It's taking all that incredible data that we've been building over the last several years within the EHR and actually doing something with it to improve the workflows within the EHR, not just add more to the data.
Okay, you did have one last minute question from Jason, who asked, how much longer does it take to get an app into the EHR this way versus using the EHR vendor or internal IT directly?
So when we actually engage with a customer, that's a great question. We still need to leverage the EHR build team at a customer site to do that build. So it's really just providing the insight and kind of the knowledge of how to do it, not necessarily leveraging the vendor to do it for the customer or not engaging the customer's IT staff to help with that effort.
Okay. Well, that looks like that's all the questions. So I think we'll go ahead and wrap up.